Congenital diaphragmatic hernia, or CDH, is a serious birth defect where there is a hole in the diaphragm, the muscle that separates the chest from the abdomen. This hole allows organs, like the intestines, stomach, or liver to push up into the chest cavity, where they compress the developing lungs. This happens very early in pregnancy, during a critical window for lung development. As a result, the lungs are often under condition called pulmonary hypoplasia, and the blood vessels in the lungs are abnormally thick, setting the stage for severe pulmonary hypertension after birth. This combination of small, stiff lungs and high blood pressure in the lungs is the primary cause of illness in these babies. CDH occurs in about 1 in every 3,000 to 4,000 live births and is slightly more common in boys. Today, most cases, though not all, are detected before birth. During routine prenatal ultrasounds, at birth, an infant with CDH will typically have immediate, significant respiratory distress. The severity can range from mild to life-threatening. On physical exam, doctors might notice a scaphoid or abdomen because the contents are up in the chest, a barrel-shaped chest, and absent breath sounds on the side of the hernia, which is most commonly on the left. It is crucial to understand that CDH is often not an isolated problem. Approximately half of affected infants have other associated congenital anomalies. The most common are heart defects, which occur in about 15 to 20% of cases. Other systems, like the brain, kidneys, or skeleton, can also be involved. In about 5 to 10% of cases, CDH is part of a broader genetic syndrome. The diagnosis is confirmed after birth with a chest X-ray, which will show abdominal organs in the chest cavity and a shift of the heart and median to the opposite side. A critical next step for every newborn with CDH is an echocardiogram, or heart ultrasound. This test is done to rule out associated heart defects and to assess the severity of pulmonary hypertension, which guides all treatment decisions. Initial management is focused on gentle respiratory support to avoid further lung injury, decompressing the stomach with a tube, and carefully managing blood pressure. The definitive treatment is surgical repair of the hole in the diaphragm. But this is only done once the baby is medically stable, which can sometimes take days or weeks. Despite major advances in care, CDH still carries a significant risk of mortality and long-term morbidity, including chronic lung disease, neurodevelopmental delays, and gastroesophageal reflux. In rare cases, a small defect may go unnoticed in the newborn period and present later in infancy or childhood with either respiratory symptoms or gastrointestinal issues like end of summary.